Management of time and space for Giga session without compromising safety and result of hair transplant. No conflict of interest to declare. Hair transplant is one of the commonest aesthetic procedures with the demand of higher coverage and maximum density in minimum sessions even in advanced grade of baldness. This need large number of grafts to be implanted without compromising the outcome of hair transplant, and it requires gross management and planning. If number of grafts are implanted more than 3000 in one session, then it is known as mega session. If more than 4000, then it is giga session. And we commonly implant 3 to 4000 grafts in one session of 1 day and 5 to 6000 grafts in one session of 2 days. And our objective is to get maximum coverage in minimum sessions of hair transplant by time and space management without compromising safety and outcome of hair transplant. Usually, cases of Norwood stage 5 and above need mega and giga session. So we use combinations of settings to create enough room for greater number of persons to work simultaneously without fatigue. For this, we use thigh massage chair, Buddy's technique of harvesting, simultaneous excision implantation, Buddy's implantation, combination of scalp and body hair follicle in one session to get maximum number of donor hair follicle, and to get best outcome of hair transplant, we keep graft out of body time less than 2 hours, use of autologous platelet-rich plasma as graft holding solution, and no touch to root implantation to minimize trauma to hair follicles. So this is thigh massage chair. You can see patient is sitting comfortably, and 3 sides of the patient, that is from the front and 2 lateral sides, there is enough space for working. So managing scoring, extraction and implantation of graft simultaneously will grossly reduce overall time of surgery and patient's fatigue. Our aim is more than 3 or 4 persons can work together. So approximately 30% of the extracted grafts are implanted simultaneously, and it reduces out of body time of grafts to great extent. This is the video showing simultaneous implantation. So you can see 2 surgeons are working from the lateral sides of the patient. Patient is on the thigh massage chair and 1 technician is implanting the graft. So these 3 persons, they are sitting and 2 assistants are standing, and there is enough space and room for them to work. Again, this video, it shows 4 persons are working simultaneously on the occipital area of the patient. So 2 surgeons are scoring and 2 assistants are extracting, and they are very comfortable in doing so. So thigh massage chair provides more space for person to work together and help to reduce time of surgery. For scalp and chest donor, 2 surgeons can harvest together and 1 technician can implant the graft. So this is the chest hair follicle extraction. Chest hair follicles, as we all know, are very delicate, and to get good results, out of body time of this graft should be minimum. So you can see these are the chest hair follicles, and these grafts are implanted simultaneously, and it improves the result of hair transplant. This is the beard hair follicle extraction. The position is little tricky, but some of the grafts can be implanted simultaneously. This is the no touch to root implantation to minimize trauma to the hair follicle, and we use Buddy's technique, that is 2 technicians, they implant simultaneously to reduce the time. Implanters can also be used to implant and minimize injury to the graft. These are some of the results. So this is the patient result after 1 year of hair transplant. 4000 grafts approximately are implanted in 1 day. So we take out 3000 from the scalp and 1000 from the beard. This is after 10 months of hair transplant. 5000 grafts, 3000 from the scalp and 2000 from the beard. This is the result of 4900 grafts, scalp 2996 and beard around 1900 in 2 days. This is after 10 months and 3500 grafts are implanted in 1 day, 2900 from the scalp and 600 from the beard. So challenges for the surgeon are to harvest maximum grafts from the scalp without compromising donor area, use of extra scalp donor area with all precautions to keep anesthetic dose within safe limit, implantation of large number of grafts, taking care of graft out of body time, and to reduce overall time of surgery to avoid patient and doctor's fatigue and achieve optimum result of hair transplantation. And this all is to be done in one session, so he must take care of any possible emergency. 2 days planning for implantation of more than 4,000 graft is a need for safety and success of major hair transplant procedure. Saving of time on every step of hair transplant without quality compromise is another challenge. Thigh massage chair for scalp hair follicle extraction and implantation, different comfortable position for beard and chest hair follicle harvesting and simultaneous implantation help in many ways. Keeping graft in plasma and no touch to root implantation, they improve the result of hair transplantation. Pleasant operating environment, frequent short breaks and drinks, well-trained staff, surgeon experience, they are another contributing but essential factors for success of Giga session. So take-home messages. Patients' demand for higher density, more coverage and natural look cannot be ignored in today's era of hair transplant. Advancement in technique of follicle harvesting, use of extra scalp hair follicle, good quality punches, more and more understanding of hair science with proper management of time and space during surgery has given us liberty to harvest and implant large number of hair follicles in minimum sessions without compromising the outcome of hair transplant. Thank you.